Hey everyone, welcome back to InsightRx. Today we have Dr. Rashmi Patel. Her passion lies at the intersection of everything children. She's a board certified pediatrician and co founder and director of a nonprofit school for children. She has a special interest in academic medicine and enjoys being stepped into a learning environment. Experiencing her father's passion for cardiology and being involved in spiritual process focused on self-development sparked curiosity of the marvel of God's creation, the human body within her. As a physician, she felt that it was a privilege to serve children and families on their uniquely magnificent life journeys. This spurred within her the interest to draw out the infinite potential within each child as a daily pursuit at the Ethos School. Nurturing the mind, body, and spirit of children has become her life's purpose. Welcome to InsightRx.
It's great to be here with you, Devanshi. Thank you, Gayatri, for inviting me today.
So, first, we're going to start talking about how you decided to choose pediatrics and what drew you to it. So, what drew you to pediatrics specifically, and why children remain your passion?
Yeah, when I started the journey in medical school, I actually thought I was going to do something very different. I thought I was going to be pursuing internal medicine, which would just be seeing adults. So very, very different from pediatrics. And while I really enjoyed spending time with children, even then, at the time I thought I wouldn't be able to bear seeing children in pain. And so that's why I felt a little averse to pediatrics to begin with. But it wasn't until my pediatric clinical rotation during my third year at a children's hospital in New York that my eyes really opened up to what possibilities lay in the pediatric realm. I remember a few patients vividly that taught me some of the greatest lessons, and I wanted more of it. I remember there was an 8-year-old boy who had come in and he was having seizures. And many times he'd been kind of in and out of the hospital. And at this time, they needed to place an IV when he was admitted this time. And since he had had chronic problems, he was familiar with the routine of getting an IV placed. But despite that, the hospitals had play therapists, occupational therapists that were there to help feel more comfortable for the children to feel like they could, be at ease as much as possible. And so they gave him a little care and showed them why we would need an IV and how an IV would be placed to help comfort him. He looked so brave and he put his arm out and he's ready. And in that moment, I just thought, there is so much for me to learn from this 8-year child who otherwise could feel traumatized by going through repeated experiences with medical professionals. And yet there was a sense of courage in him that felt like something I wanted more of to build that within myself. I remember another child who, again, had chronic respiratory disease. And when I was in the room, we were happily playing a game together. And he suddenly had aspiration and immediately signaled to be suctioned. And at that time, obviously, he is having difficulty breathing. He's aspirating, something that can feel very kind of having really an attack at the moment. And just a couple of minutes after he was suctioned and he was able to have airflow properly, immediately back to playing this game with me as happy as he could be. And that taught me what it is like to be resilient. And there's so many occasions that I can recount that really made me feel like pediatrics was going to be the path. If I really wanted to try to be a better human every day, it was going to mean being around children that would be able to teach me how to be a better human.
Mhm. That's really an inspiring story, what you said there. And how do you see the role of pediatricians going beyond just treating illnesses?
Yeah, pediatricians play a really interesting role. I'm biased, of course, being a pediatrician, but it's different because you actually build a connection with the whole family. Since your patient is born through age 21 for many pediatricians, you walk the journey alongside them, alongside their parents, their siblings, other caregivers that they may have in their life. And so it's an incredibly unique opportunity not to just treat the physical ailments, but to be able to holistically build a relationship with child and with family. And with that comes opportunities to be able to discuss things that otherwise may not think of as being opportunities whenever you're in a doctor's office, but opportunities that presented themselves were conversations about parents feeling like, how can we prevent from having so much dysfunction in our family? How can I help my child really be able to achieve their potential? These types of conversations are much more personal, much more vulnerable than other avenues might allow. These conversations are really what I think is the heart of pediatrics, and truly that is having a relationship with the whole family and cultivating a sense of trust, respect, and intimacy with the child as well.
Could you share a story from your medical practice that changed how you see children and families?
Absolutely. It was in an outpatient clinic that I was working in, and a mother had come in with her son, who was 10 at the time. And she had mentioned that their animal physical, and mentioned that the teachers had been complaining a bit about his ability to be able to stay focused, stay on task at school. And it was interesting with the child, and trying to just get a better grasp on the situation. It was incredible to see how bright he was. He was curious. He asked me a lot of questions. He was engaged, and it was hard for me to understand what the disconnect might be, because for as a child to be that engaged in the doctor's office is not commonplace, and yet the mother was sharing that she was getting reports of him not really being involved as much in the classroom. And so I had asked for a follow-up appointment, and we went down the line of what otherwise maybe exploration of ADHD, whereas doing more depth exploration of what's happening in different environments for him at school, at home. Uh, and as I continued to see them in a follow-up, I felt that from what the teachers had shared, what the mother had shared, and what my independent assessment was, it wasn't that he was someone who had attention deficit hyperactivity disorder. It truly felt like perhaps the environment that children are in today, school, being at a desk for 7.5 hours in a day, may not really correlate to child development and how to be able to facilitate that best. So he was very memorable to me.
Yeah, that's a really cool story. So what led you to co-found the Ethos School, and what did you need to see in the education that wasn't already being met, as you mentioned with the ADHD kid? So like what motivated you?
Yeah, so really, I feel like the story that I just shared is probably the best example of one of these patients, and I saw so many of them, and I felt inside of me a sense of hesitancy to put a child on medication for ADHD when really even the protocol that's laid out for ADHD assessment, diagnosis, and treatment was not. Uh, Consistent across all environments. And that led me to explore a bit further to see, is there an opportunity to be able to inject a little bit of creativity in thinking about what approaches may be feasible for some of these children? So for the patient that I mentioned earlier, as I asked him more, it seemed like he was just quite bored in school. And that is why perhaps he was talking a bit more or acting out. And so on the prescription pad, because the power of what prescription pad can hold, as a physician, on the prescription pad, I wrote out suggestions for things that he could be doing at home. Khan Academy, for example, a resource that they would have accessible that would challenge him and hopefully allow him to feel he was competent, and get some positive reinforcement with. So I think it was a series of such encounters that made me think about education and what it might be like to be involved in a process of reinventing education may be like for children.
How do you nurture not just the mind, but also the body and spirit of a child in practice?
I think there's a lot of attention now in today's age to mind body medicine. I have to say, when I'm going through medical school, there was little to no acknowledgement of that and the interplay between the psychology of a human as well as how it impacts different systems within the body. And so I think I have really appreciated the movement for complementary or alternative medicine therapies, as well as just a further exploration of how the entire body is interrelated. And we are not physicians of specific specialists, about the heart or the lungs. Sure, that's how we may be trained, but the human body as a whole, it is not compartmentalized. And the mind facilitates more than even what we know now. Just simple things that we may have heard of as far as the impact of stress on our body, whether that is, being more prone to diabetes or specific organs, even about depression, anxiety, and how that might impact different systems. I feel like post COVID, certainly there's a lot more emphasis and attention on whole body wellness. And I think it's a physician's responsibility, a pediatrician or really any physician, to ensure that a patient is looked at holistically.
Mm-hmm. Yeah, so staying on the same track, how did your father's passion for cardiology and your spiritual process shape your own journey in medicine?
Yeah, that's a special one. I could take us back to my childhood. I remember, so I grew up in a very small town in Asheboro, North Carolina, and I remember going to the local grocery store and running into one of my father's patients, and they would just talk about how much they enjoyed spending time with him whenever they went to go see him, or my father coming home with loaves of freshly baked bread, different fruits that his farmer patients may have brought in. I guess just the love that felt um, through some of those interactions matched with the passion that my father had for cardiology. I think the love that was cultivated as a result of the relationship, as well as the genuine interest and fire within my father for cardiology, were probably two of the most attractive things. But I feel like it's important along these lines to also mention that, when I was in college and I was planning on majoring in biology and thinking about being on the pre-med track, uh, I really appreciated something that my father did that I think was atypical, but was so needed. He had given me articles of kind of what the mental health of physicians were, and I remember he gave me an article that talked about suicide rates of doctors. And at the time, I was really perplexed because I was like, I don't think I've ever seen my dad unhappy practicing medicine. Like, he loves this. So, is he trying to deter me? Like, I don't. And as a little bit more, I read the article. It was certainly eye-opening for me. But he had mentioned at the time, that he said, I feel like it's important to have the full picture of what field of medicine is like. And you may have, just had kind of this one perspective growing up in our household, but understanding what the climate is like, understanding what, challenges are that physicians face, the reality of it is important to be aware of and then to make your decision. So I just really appreciated that one, objective information, and two, just his awareness and conscientiousness of ensuring that I made a well-informed decision.
What challenges do you face running both medical career and nonprofit, and how do you manage that?
Yeah, this takes some One of my friends asked me recently, and she was like, "How do you find balance in life?" I'm still trying to dissect what that word means because I think from any outsider's perspective, we lived pretty imbalanced lives as far as, schedules and bandwidth and how all of our time and energy is used. But I think at the heart of it, it comes down to fulfillment and harmony. And that's kind of how I see both of these paths. They feel very concordant. While pediatrics, mm, treating patients, have the opportunity to connect with families, at school, it's the same thing. I just get bonus time, right? In encounter with the patient, I might get anywhere from 15 to 30 minutes. At school, we have the opportunity to be able to build relationships longitudinally as children are 3 and 4 and, become older in fifth and sixth grade. So, uh, you know, time uh, is finite, of course, but I think that being involved in both processes and the way that it energizes me allows for more than I feel like I could have accomplished had I not given it a shot.
And on a final note, if you could leave one message with students listening to this podcast, what would it be about unlocking their potential?
I think there's a lot of times that personalities that may be more inclined towards STEM, medicine, may feel the need to try to be perfect and striving for perfectionism in a highly competitive world, in a very self critical environment we tend to live in. And specifically, I would say students that are thinking about following this path, the predilection to having that personality, I think, is quite high. And in the process, sure, you're able to jump through the hoops well. You're able to have this outstanding GPA and, a whole host of glowing things on your resume. But at the same time, I think allowing yourself grace to fail and embracing your weaknesses in the process allows one to preserve a growth mindset whenever you're in a process that doesn't really allow for much flexibility to fail. I think it also is important to extend that grace to yourself. Um, I think that helps to hopefully alleviate the pressure, the stress, and everything that comes with being somebody that follows this path. And I just hope, knowing what the journey entails to get to this point of finally achieving your goal, I hope that the journey is enjoyable and really just to be able to take that pressure off of you, while at the same time, of course, doing your best. But you have infinite potential within you if you just allow yourself to really be able to see your own beauty and unravel layers of yourself in the process, then really it's phenomenal to see what one can achieve.
And on that note, we thank you for letting us have you on our podcast today. All the stuff that you said was very insightful. It was very inspiring too. Thank you so much for agreeing to record with us.
Oh, thank you, Gayatri. Thank you, Devanshi. I think it is wonderful that you guys are doing this, especially at this stage. I think it is something that is very worthwhile to take a moment to reflect. As we hear opinions, right? This is experiential to be able to hear from those that have gone on the path and uh, consider kind of what you would like to do at the junctures that all of you are at right now.